Hello everyone, welcome. I am Marlene Marino, one of the instructors here at UMA. In our course this week, we are discussing Blue Cross and Blue Shield. So that now that you're probably more familiar with the Blue Cross and Blue Shield, let's take a look, an in-depth look at the different types of plans under Blue Cross and Blue Shield. So to recap, we know that Blue Cross plans originally covered only hospitals, and then Blue Shield plans covered physician services. Not all plans, guys, so keep this in mind, not all plans are the same. And not all patients that have the same plan under Blue Cross and Blue Shield will have the same benefits. So I'm going to say that one more time. Not all plans are the same, and not all patients that have the same plan under Blue Cross and Blue Shield have the same benefits. So one of the things that we're looking at this week is the difference between participating and non-participating providers and what each of them have to do. So participating providers, they submit the insurance claims for the subscribers, meaning the patients. They bill the patients for deductible, copay, and coinsurance amounts that are based on an allowable fee. They provide access to provider relations department for claim resubmission, and they also write off the difference between the amount that was charged by the provider and the fee that was approved. That's participating provider. On the other hand, we have non-participating providers, could be Blue Cross and Blue Shield or any other insurance. They have not signed contracts with those insurance companies. They are expected to be paid in full fee from the patient, and the patient once again will pay that fee in full. So once again, we went back and looked at Blue Cross and Blue Shield. We know that not all plans are the same. Not all patients that have Blue Cross and Blue Shield would have the same benefits. And we also talked about the difference between par and non-par. So what about the plans that are available under Blue Cross and Blue Shield? So they have the following types of health insurance coverage. Blue Cross fee-for-service or traditional coverage is selected by individuals who do not have access to a group plan, number one, or number two, and many small businesses employers. These contracts are divided into two types of coverage within one policy. So we have basic coverage and major medical benefits. The minimum benefits under Blue Cross and Blue Shield basic coverage include things such as hospitalizations, x-rays, obstetric care, intensive care, newborn care, and like chemotherapy. That's only to name a few. And then on the other hand, for Blue Cross and Blue Shield major medical, so of course it includes everything that the basic coverage has, but it also includes your office visit, your non-surgical treatment, behavioral health encounters, allergy testing, and prescription drugs. Again, that's only to name a few. Major medical services are usually subject to a patient deductible and co-payment requirements, and in many cases, the patients may be responsible for filing the claims for those benefits. So again, comes to show not all plans are the same, and not everybody that has one insurance all have the same benefit. So that's for fee for service. We also have an indemnity coverage under Blue Cross and Blue Shield. So Blue Cross and Blue Shield indemnity coverage, what it does is it offers choice and flexibility to subscribers who want to receive a full range of benefits along with the freedom, keyword here, freedom to use any licensed healthcare provider. So they have flexibility and freedom. Their coverage is going to include hospital only or comprehensive hospital and medical coverage. So there is that flexibility and freedom. Subscribers share the cost of the benefits through co-insurance options. They do not, listen to this, they do not have to select a primary care provider. So because of that, they do not need a referral to see a provider. So again, it's that choice and flexibility. So what other plans? So Blue Cross and Blue Shield also includes managed care options. So managed care is a healthcare delivery system that provides healthcare and control costs through a network of physicians, hospitals, and other healthcare providers. So here on our screen, we have the managed care plans under that Blue Cross and Blue Shield offers or include. So they are coordinated home health and hospice, EPOs, HMOs, OPAP, POS, PPO, and SSO. So let's take an in-depth look at each and every one of these. So coordinated home health and hospice care program. This particular program allows patients with these options to elect an alternative to acute care setting. The patient's physician must file a treatment plan with the case manager that is assigned to review and coordinate these cases. All authorized services must be rendered by a personnel from a licensed home health agency or an approved hospice facility. So once again, this particular option allows patients to select an alternative to their acute care setting. Okay. The next one that we have on here is EPO, or exclusive provider organization. So this is similar to an HMO or a health maintenance organization that provides healthcare services through a network of doctors, hospitals, and other healthcare providers, except, here's the exception, except that members are not required to select a PCP. PCP meaning primary care provider. Also, because they do not select a PCP like you would in your HMO, they do not need a referral to see a specialist. Now, they must, and I repeat, they must obtain services from EPO providers only. So they don't have to select a PCP, they don't need a referral, but they must obtain services from an EPO provider only. Or what's going to happen is that the patient is going to be responsible for those charges. Okay, so a primary care provider or PCP, remember, this is the physician or other medical professional who serves as the subscriber's first contact with the plan's healthcare system. PCPs, you hear it called primary care physician, primary care provider. You also hear it called gatekeepers. You know, you go see them when you need a referral, so they can open the gates and let you see a specialist, or they can say, listen, you don't need to see a specialist. I'm going to manage this particular condition that you have. Okay, perfect. Perfect. We have more plans. We're not done just quite yet. So we have health maintenance organization, or HMO. So all Blue Cross Blue Shield corporations now offer at least one health maintenance organization plan, or HMO plan, that assumes or shares the financial and healthcare delivery risk associated with providing comprehensive medical services to the patients or the subscribers in return for a fixed prepaid fee. Okay, so we have at least one. Some plans were for-profit acquisitions, other were developed as a separate nonprofit plans. Some examples of those plans, those HMO plans, are from Blue Cross and Blue Shield are like Capital Care, Columbia Medical Plan, because familiar Blue Cross and Blue Shield names are not always used in the plan. Some HMOs may not be easily recognized as a Blue Cross and Blue Shield plan. So usually what would happen is on their ID card, you would have that Blue Cross and Blue Shield trademark. So, you know, once again, not all the plans are going to say, you know, manage Blue Cross and Blue Shield, for example. They would have other names, and a lot of the times you will be able to discern that by looking at the patient's ID card, and sometimes you might not. So keep that in mind. Again, not all plans are the same, and not all of the same, you know, like Blue Cross and Blue Shield, everybody has the same benefits. So the next one that we have on here is Preferred Provider Organization, or PPO. This is what we call a subscriber-driven program. So a PPO, what it does is it offers discounted healthcare services to subscribers who use a designated healthcare providers who contract with the PPO, but also it provides coverage for services rendered by healthcare providers who are not part of the PPO network. See? The Blue Cross and Blue Shield PPO plan is sometimes described as a subscriber-driven program, like I just mentioned, and Blue Cross and Blue Shield substitutes the terms subscriber or member for policyholder, which is something that you hear a lot by commercial carriers. You hear them call, instead of subscribers, we call them policyholders. So Blue Cross and Blue Shield does the same thing. But in this type of plan, the subscriber or the member is responsible for remaining within the network of PPO providers and must request referrals to PPO specialists whenever possible. The subscribers must also adhere to the managed care requirements of the PPO policy, such as obtaining required second surgical options and or hospital admission review. And we'll talk a little bit about that second surgical option here shortly. Failure to adhere to those requirements, what do you guys think is going to happen? It's going to result in a denial of any surgical claims or even reduced payment to the provider. So in those cases, the patient will be responsible for the difference or the balance between the reduced payment and the normal PPO allowed rate. So, there are some restrictions within PPO, but at least a little bit of the difference between HMO and PPO. Now, something else to note about PPO plans is that when subscribers or their members go outside the network for healthcare, the approval of the PCP is not required, but costs are usually higher to the patient. When subscribers undergo procedures that are not covered by the policy, guess what's going to happen? They will be responsible for paying the provider for that care. So once again, it's a little bit more flexible than your HMO, but there are some restrictions. So a couple more plans. We have the Outpatient Pre-Treatment Authorization Plan, or OPAP. I like to call it OPAP. It requires pre-authorization of outpatient physical, occupational, and speech therapy services. In addition, this particular plan requires periodic treatments or progress plans to be filed. For the outpatient pre-treatment authorization plan is a requirement for the delivery of certain healthcare services and is issued prior to the provisions of care. So these pre-authorization, they are required and they have to be issued prior to the provision of the care. Sometimes we hear these plans being called prospective authorization, or for those authorizations, we also hear them being called pre-certification, okay? The next type of managed care plan under Blue Cross and Blue Shield, or that Blue Cross and Blue Shield offers, is the POS plans, or point of service. A point of service plan allows the subscribers, members to choose at the time medical services are needed, whether they will go to a provider within the plan's network or they will decide if they're going to go outside of the network. But this is what happens. You ready? When subscribers go outside the network to seek care, they're going to have what? Out-of-pocket expenses and co-payments that are usually going to increase. POS plans provide a full range of inpatient and outpatient services, and subscribers choose a PCP, or primary care physician, or provider from the payer's PCP list. The PCP assumes the responsibility for coordinating the subscriber and dependent medical care, and the PCP is often referred as, I just said it a few minutes ago, as the gatekeeper of the patient's medical care. The name and telephone number of the PCP is going to appear on the POS plan, the actual ID cards, and also written referral notices issued by the PCP are usually mailed to the appropriate local processing address following the transmission of an electronic claim. Because the PCP is responsible for authorizing all inpatient hospitalizations, a specialist office should contact the PCP when hospitalization is necessary. That's really important. Also, do a follow-up that call with one of the utilization control office at the local Blue Cross and Blue Shield plan office. So those are things that we need to keep in mind when dealing with a POS or a point of service plan for our patients. And we have the second surgical opinion. So this is our SSO option. So the mandatory second surgical opinion requirement is necessary when a patient is considering, listen to this, elective, non-emergency surgical care. So the mandatory second surgical opinion requirement is necessary when a patient is considering elective, non-emergency surgical care. The initial surgical recommendation must be made by a physician qualified to perform the anticipated surgery. If a second surgical opinion is not obtained prior to the surgery, what do you guys think is going to happen? You guessed it. The patient's out-of-pocket expense is going to be greater. It's going to maybe greatly increase. The patient or surgeon should contact the subscribers, Blue Cross and Blue Shield local plan for more instructions on these. In some cases, the second opinion must be obtained from a member of a select surgical panel. So they might have a panel that the patient will have to select. In other cases, the concurrence of the need for surgery from the patient's PCP may suffice, may be sufficient. A lot of different plans, a lot of different requirements, but we still have more. So the Federal Employee Health Benefits Program, this is an employer-sponsored health benefit program that was established by an act of Congress back in 1959. So the Blue Cross Blue Shield Federal Employee Program began covering federal employees on July 1st, 1960. So it didn't happen like right away, but within a couple of months and a year. And now provides benefits to more than 5 million, guys, 5 million federal enrollees and dependent. Wow. Wow, wow, wow. So it started back in 1959. In July 1st, Blue Cross and Blue Shield began covering federal employees. And now we have more than 5 million federal enrollees and dependent under this plan. Wow, just amazing. Now, for Medicare supplemental plans, the Blue Cross and Blue Shield corporations offer several federally designed and regulated Medicare supplemental plans, which augmented the Medicare program by paying for Medicare deductibles, co-payments, and also even co-insurance amounts. These plans are better known as Medigap plans, so you probably have heard this term before, and are usually identified by the word Medigap on the actual ID card from the patient, the medical ID card from the patient. The other type of plan that Blue Cross and Blue Shield offers is Healthcare Anywhere. So Healthcare Anywhere, this is a concept that allows members of independently owned and operated Blue Cross Blue Shield plans to have access to their benefits throughout the US and, listen to this, around the world, like literally anywhere, healthcare anywhere, but this is going to be dependent on their home plan benefits, okay? In the card, you would usually see like a little blank suitcase logo on the patient identification card to indicate this is a Healthcare Anywhere coverage. Okay, so the Blue Card program, under this program enables such members obtaining healthcare services while traveling or living in another Blue Cross and Blue Shield service area within the United States or in another country to receive benefits of their home plan contract and to access local provider networks. So it's not just here, it's not just around the world, but also, your home plans. Like, for example, I'm in Florida, so there's Blue Cross and Blue Shield of Florida, Blue Cross and Blue Shield of Alabama. That's what it meant by their home Blue Cross and Blue Shield plan. Okay. Now, for the away from home care, this is a program that allows Blue Cross and Blue Shield plan members who are temporarily residing outside of the home service area for at least 90 days to temporarily access care from participating providers in other areas of the United States. So away from home. So such members usually include dependent students that could be, like, for example, attending school out of state, family members that are residing in a different HMO area, also long-term travelers who work assignments in other states, and also retirees that have dual residency. The next program is the GeoBlue. This is international healthcare coverage for employers, individuals, and students who are based in the United States and who are short-term travelers or long-term expatriates. We have the Blue Cross Blue Shield Global. This includes international healthcare coverage for non-US based individuals and groups. So this particular program is going to cover individuals who permanently reside outside of the US and provides healthcare coverage during short-term and also during long-term travel. So again, multiple plans, different plans in your home state or home office, and throughout the US and also outside of the US for long-term and short-term. So guys, the objective of this video lecture focused around the different types of plans under Blue Cross and Blue Shield, and as you can see, there are several. So remember, with so many different plans, it is important that we contact the payer to request specific claims completion and instruction that we can make sure that we have that we have proper coding and proper billing of those claims. We understand, yes, this is Blue Cross and Blue Shield. We understand, okay, well, which one is it? And now we know the specific claim instructions so that we can make sure that we have a clean claim being sent, or a claim without errors. So as you reflect on this topic and prepare to do the rest of the work for this week, make sure to use this content, the material in your readings, the interactives in our course room, and also you can do a little bit of research on your own using the UMA library. But if you're not using the UMA library, make sure that you're using reliable sources, okay? Reliable sources. This way you can maximize your learning. So thank you all so much for listening. Let's have a great class, guys, and have a great day.